managing a scuba diving injury. As a DAN oxygen provider, it's important to know the signs and symptoms and be prepared to respond with oxygen in the unlikely event of a diving injury. Oxygen is the key supporting element of life. It's a colorless, odorless, and tasteless gas and makes up 21% of the atmosphere. However, pure oxygen can be breathed alone and is commonly used for medical purposes. When someone is ill or injured, high concentrations of oxygen are recommended to be provided in response to hypoxia in emergency situations, such as during a heart attack. Oxygen poisoning, or toxicity, is a hazard associated with breathing high concentrations of oxygen, but is rare. Two forms of oxygen toxicity can occur. Central nervous system oxygen toxicity may develop when breathing increased partial pressures of oxygen, such as when using enriched air nitrox or other mixed gas. Pulmonary or lung toxicity can occur when breathing high concentrations of oxygen for an extended period of time. Oxygen toxicity is very unlikely to occur when providing emergency first aid and is not a serious concern for the DAN oxygen provider. A more serious hazard involves the handling of oxygen cylinders. While oxygen is not flammable, all substances need oxygen to burn, and oxygen accelerates fire. The fire triangle consists of heat, fuel, and oxygen. Problems associated with fire and emergency oxygen delivery devices are rare. Like handling scuba cylinders, following these recommendations will minimize the risks associated with handling oxygen cylinders and emergency oxygen delivery equipment. Don't allow oil, grease, or other contaminants to come in contact with oxygen cylinders and equipment. Oxygen cylinders should not be exposed to temperatures over 125 degrees Fahrenheit or 52 degrees Celsius. Avoid leaving your oxygen cylinders in your vehicle trunk for extended periods of time. Extinguish all smoking materials and open flame in and around oxygen equipment. Provide adequate ventilation when providing or using oxygen. Only use equipment intended for use with oxygen. Avoid adapting scuba equipment for use with oxygen. Make sure that oxygen-compatible washers and other materials are used. Carry portable oxygen cylinders with two hands, and when transporting them in a car, secure and block cylinders to prevent them from rolling. Make sure your cylinders are appropriately labeled for oxygen use and that they are within the required hydrostatic test date. These oxygen safety recommendations are easy to follow and will increase your safety in and around oxygen. While there are many grades of compressed oxygen available, three common grades are aviator grade, medical grade, and industrial grade. Use only medical or higher grade oxygen that is suitable for breathing. Industrial grade oxygen guidelines allow for certain impurities and other gases to be contained in the cylinder. Industrial grade oxygen is not generally recommended for use in a diving emergency. In order to get your oxygen cylinders filled, you may need to present the oxygen distributor your DAN oxygen provider card or a prescription. In many areas, oxygen is a prescription drug, and it may be difficult to obtain oxygen for your emergency oxygen cylinder. Ask your DAN oxygen instructor or contact DAN for information on oxygen filling requirements.
Let's get his equipment up.
The benefits of providing emergency oxygen to an injured diver are substantial. When a scuba diver experiences a near drowning or diving injury, oxygen deficiency occurs. Your first priority as a DAN oxygen provider is to provide basic life support by ensuring the airway, breathing, and circulation for the injured diver. Anytime a pressure-related dive injury or near drowning is suspected, oxygen should be provided following the primary assessment of the ABCs. A diver having difficulty breathing or who is unresponsive should also receive oxygen. In general, every person whose illness or injury suggests possible oxygen deficiency should receive supplemental oxygen. The use of emergency oxygen increases the chance of complete symptom resolution before hyperbaric therapy treatment. After hyperbaric treatment, there's also a better chance of being symptom-free. Oxygen first aid improves the health of injured divers and provides for these specific benefits. May reduce bubble size and facilitates the elimination of nitrogen by creating a pressure gradient where nitrogen is reabsorbed from the bubble and eventually exhaled from the lungs. The higher the concentration of oxygen inhaled, the faster the nitrogen is eliminated. That's why 100% oxygen is recommended for injured divers. Oxygen first aid may also oxygenate hypoxic areas and tissues. May reduce tissue swelling. May ease breathing. Providing oxygen to an injured diver will cause no further harm, may improve or eliminate symptoms, and may reduce the amount and severity of symptoms after hyperbaric treatment. Hopefully you'll never need to use oxygen, but if you do, you know it's critical for helping the injured diver. There are 4 components of an emergency oxygen delivery system. The 4 components are the oxygen cylinder. You should carry enough oxygen to be able to provide continuous delivery of oxygen from the time of injury at the dive site back to the next level of emergency response. Portable oxygen cylinders can last up to an hour or more, and some non-portable oxygen cylinders can last up to 8 or more hours. The duration of oxygen supply varies based on the size of the oxygen cylinder, the flow rate and type of delivery device, and the demands of an injured diver. You may need to carry more than one cylinder if you're a great distance from help. Cylinders are made of either steel or aluminum and are subject to periodic hydrostatic testing. To minimize the risk of using an oxygen cylinder for an unintended purpose, oxygen cylinders are color-coded and cylinder valves designed so that other regulators are incompatible with non-medical oxygen cylinders. Ask your DAN oxygen instructor or contact DAN for more information about testing periods, color coding, and equipment compatibility. Oxygen regulators reduce the high pressure contained within the oxygen cylinder to a working pressure so that oxygen can be provided to an ill or injured person. The multifunction regulator combines the features of both the constant flow and demand systems. It enables the rescuer to provide the highest concentrations of oxygen possible, use various mask options, and assist 2 injured divers simultaneously. An oxygen hose or tubing connects the oxygen regulator to the oxygen delivery mask and needs to be oxygen compatible. An oxygen delivery mask is placed on the ill or injured person's face and allows for the delivery of supplemental oxygen. Since the goal of using oxygen for a diving injury is to provide 100% oxygen, reviewing the types of masks based on their ability to provide high concentrations is important. The type of oxygen delivery device that is able to provide 100% oxygen is the demand inhalator valve with oronasal mask. It works like a scuba regulator's second stage. When the injured diver inhales, 100% oxygen is delivered to the lungs, which fulfills 100% of the injured diver's breathing requirements. In this respect, oxygen is not wasted. Since most diving injuries do not involve an unresponsive and non-breathing diver, DAN has developed this unique demand valve for breathing injured divers. This is the preferred oxygen delivery device for a breathing injured diver. If the injured diver is not breathing, then the device will not activate and another mask will have to be used. Another oxygen delivery device similar to the demand inhalator valve is the flow-restricted oxygen-powered ventilator. It is designed to assist or control ventilation for a non-breathing person or allow a breathing person to receive oxygen on demand. Using a flow-restricted oxygen-powered ventilator may not be appropriate for the diver who has not had proper training in its use. This device requires additional training beyond what is taught in the DAN Oxygen Provider course. The other recommended oxygen delivery device for a breathing injured diver is the non-rebreather mask. The non-rebreather mask is an effective way of delivering high concentrations of oxygen and is recommended for the breathing injured diver who does not tolerate or cannot activate the demand inhalator valve or when there are multiple diving injuries requiring oxygen. The non-rebreather mask consists of a mask with 3 non-return valves, one on each side of the mask and one separating the mask and reservoir bag. These valves help to prevent air from diluting the oxygen during breathing. There are other constant flow oxygen delivery devices that will provide supplemental oxygen, but these are not recommended because they do not deliver high concentrations of oxygen. Although diving accidents resulting in an unresponsive, non-breathing injured diver are rare, you should be prepared to provide supplemental oxygen with your resuscitation efforts. Mouth-to-mouth ventilations deliver approximately 16% oxygen to the non-breathing diver and subject the rescuer to possible disease transmission unless a barrier device is used. A mouth-to-mask barrier device like the pocket mask reduces the risk of disease transmission, and some are equipped to provide supplemental oxygen. When a pocket mask is used with supplemental oxygen during resuscitation, oxygen concentrations can exceed 50%. It's a simple and highly effective method to provide supplemental oxygen to the non-breathing injured diver. Use the appropriate one-way valves and filters to reduce your risk as a DAN oxygen provider. Other types of oxygen delivery devices are designed to provide supplemental oxygen, but require additional training, such as the flow-restricted oxygen-powered ventilator and the bag valve mask. Ask your DAN oxygen instructor or contact DAN for additional training opportunities. DAN has designed a series of oxygen units specifically with divers in mind. Each unit is capable of delivering high concentrations of oxygen to injured divers. DAN oxygen units come with a multifunction regulator to provide oxygen to 2 injured divers and a demand inhalator valve to deliver 100% oxygen. They come with an oronasal mask and a non-rebreather mask. Various cylinder sizes are available depending on the type of diving you do. DAN oxygen units come in a water-resistant case and may be complemented with a DAN first aid kit and other oxygen delivery devices for those oxygen providers with additional training. Contact DAN for more information on DAN dive safety products. Providing oxygen first aid to injured divers is not difficult to learn, and there are some simple guidelines to follow. First, remember to save yourself. Avoid risking injury to yourself when helping another diver. Second, assure the airway, breathing, and circulation of the injured diver. Third, provide the highest concentration of oxygen possible. 100% inhaled oxygen via demand valve is recommended. Fourth, activate the emergency medical system in your area. Remember, injured divers need to be evaluated by a healthcare professional for possible referral to definitive treatment at a recompression facility. Call DAN's Diving Emergency Hotline for consultation and other assistance for diving injuries. The specific skills you'll learn and practice during the DAN Oxygen Provider course are scene safety assessment, review of basic life support. For breathing injured divers, use of the demand inhalator valve, use of the non-rebreather mask. For non-breathing injured divers, use of the pocket mask with supplemental oxygen. You'll also learn how to provide oxygen to 2 injured divers and how to assemble and disassemble the DAN oxygen unit. before coming